Hey, what's going on, everybody? Dr. Strong here, and my mission is to help everyone have the highest quality of life as possible. And today I'm going to be going over cholesterol and what that means for you and your health, and just the big myth that is going on about high cholesterol, why people have high cholesterol, what your body is really telling you, and then what the medical model is missing in the bigger picture of this kind of scheme that is going on that for statin drugs that could actually be causing you more harm than good. So if you haven't already, please like and subscribe to the channel. It really helps the channel out, and I try to make as much content that is relatable and can give you the best information as possible. So just help me out. Definitely appreciate all of your support. So let's go ahead and let's dive into this topic. So first, we must understand what is cholesterol. And cholesterol is a fatty, waxy substance that is found all throughout your body. And it's very essential for making your body cells, for making your hormones, for making tissue, for almost every single process in your body, even including processing vitamin D. And a lot of these processes occur in the liver, especially when we're talking about vitamin D or the sex hormone production. So when it comes to cholesterol, we know that we need it essentially to make almost everything that's essential to living and energy production in our body. With that being said, you may be going to your doctor and they're telling you that you have high cholesterol and that this could be potentially a bad thing. But the one thing that they don't tell you is they don't really educate you about why you have high cholesterol or why it is such a big issue. And with heart disease on the rise today, I know that it can be very scary to think about high cholesterol having a high correlation with heart disease. But I'm going to share with you one thing that hasn't been told to you about why people are having heart disease, and it's actually not cholesterol that is causing all of this heart disease and heart attacks that's going on. There's actually a hidden underlying mechanism, and cholesterol is there just kind of as a consequence of this underlying mechanism causing the heart disease and heart attacks. Now, diving into that a little bit further, so what happens is that you get inflammation in the blood vessels, and the blood vessels, maybe they have a little tear in them, or maybe they have become a little bit more susceptible because there's so much inflammation. And what happens is cholesterol comes and it actually serves as kind of like the plastic or the plasty that's going over to make sure that the blood isn't leaking out, to help seal up the vessel, to make it more stable. So cholesterol is actually the good guy in this part of the equation, and what is actually causing inflammation and causing the vessels to become more susceptible to cracks or bleeds or whatever it may be is actually sugar or bacteria or viruses or something like that. It's highly correlated that sugar is causing inflammation in the vessels, which cholesterol comes and it's kind of like the firemen. So let me give you an analogy. So if you go home later this afternoon or today and your house is on fire and the firemen are there, then are you correlating the firemen to causing the fire in the first place, even though they may be starting to put it out? No, you don't really think about it that way. You think that they're there to help you. So just like that there's a fire in your house, the cholesterol is there to basically put out the fire. It's not necessarily to blame for it. Now, sugar and like viruses and bacteria and those sorts of things that cause inflammation are the main cause, and cholesterol is just the fireman. So just because it's there when an incident occurs, such as a heart attack or a bleed or some other type of issue that it's been correlated to, doesn't necessarily mean that it's the causative factor. And that's something that we really need to dive into, and you need to look at your diet assessment. You need to look at how much inflammation is going on throughout your body, how stressed you are, and there are many other factors that kind of dive into that. But for the sake of this video, we're not going to dive into that. We're going to dive into kind of just more on the bias of cholesterol and what's actually going on. Now, in the typical medical model, what they do is the first thing that they're going to do is place you on a statin. And a statin is actually there to block an enzyme and to actually cause upregulation of receptors on the liver so that you can uptake more cholesterol and kind of bring it out of the body. But the issue with that is the type of cholesterol that's moving out isn't always necessarily the oxidized inflammatory cholesterol that's going on. And like I said before, it's really not the root cause of why you're having heart disease or maybe why you're more susceptible to a heart attack. So with that being said, the statin drugs will actually reduce the amount of CoQ10 which is available in your body as well. And so that is responsible for almost 95% of your energy production. When you look at any type of Krebs cycle or anything like that, CoQ10 is a very important coenzyme to help that process go along. And the statin drugs will ultimately block that. So that can cause more side effects if you're having lethargy, fatigue, if you just don't feel motivated. Then one of the things, if you're taking a statin, this could be a very big issue when you're on that drug for an extended amount of time. Other side effects of statins can look like SAMs, or statin-associated muscle symptoms. And those look like myalgia, which is just chronic muscle pain, or you're just having muscle pain. It can look like myopathy, myositis, which is actually just inflammation in the muscle. Sometimes you can get calcification of the muscle, and it makes it very hard to move. So if you're having a lot of stiffness, that can be something that's going on. Rhabdomyolysis, so this is actually the breakdown of the muscle tissue. And so that can look like, it's very common in people who are doing like high performance athletic events, especially if they're pushing themselves too hard. But that will look like you can have dark urine, it can look like Coca-Cola urine, chronic muscle fatigue, dehydration, a lot of different symptoms can go along with that one. Joint inflammation, so almost all the people that we see in the clinic have some sort of joint inflammation, some sort of arthritis, achy joints, it hurts to move, rheumatoid arthritis, those sorts of things. Tendon disorders, so if you're more susceptible, if you're lifting weights and you're having a lot of tendon pain, or if you have like Achilles tendon ruptures or any of those sorts of things, then the statin could be a very big reason for why that's happening. And then type 2 diabetes is also one of the things that statins can cause that has been shown. Neurological problems, neurocognitive effects, so like dementia, liver and renal toxicity. And then there was also a study that said that taking statins would actually double your risk of dementia. So it's kind of one of those, like, how much do I really want to play into statins actually causing dementia, or do I want to take the risk of heart disease? And I want to let you know that I'm going to show you just real quickly how high cholesterol isn't necessarily a bad thing, and then just what you need to do and what the high end ranges are for your cholesterol. So everybody knows, I am not anti-medication or anti-surgery whatsoever. I think that there is just a time and a place when these are necessary. And in my personal rule book, if I'm not seeing or I'm not resolving the issue, if I'm having to stay on a medication longer than 2 to 3 months, a lot of the times that's when you're looking at like toxicity issues due to the medication, or you're looking like some other type of side effects occurring. And there's a deeper rooted problem going on, because if you're not getting relief, then obviously that medication isn't fixing the root cause, because it's just continually staying there. So when we're looking at that, I just want everybody to understand that I think that there is a time and place, but I don't think that it should be your primary resolution method for these types of issues. So when we're talking about the high levels of cholesterol, if you're in that 2, 3, 400 range, you're probably okay. There's probably not a lot of concern. The caveat to that is if you're eating a lot of inflammatory foods, then you're going to have more inflammation throughout the blood vessels, and you're going to have a lot more tears or a lot more susceptibility of those blood vessels to have leakage or to have cracks in them that will consequentially cause more cholesterol to come to that area and increase the overall probability of like a heart attack or developing heart disease. Now, if you're getting in that like 5 to 6 to 700 range, or even 1,000, then you need to look at like genetic dysfunctions. And then there are also studies that you can have your primary physician do, and those look like a calcium test, and they can actually score how much cholesterol is actually in the vessels. So that's on a scale of, to 400. So 0 to 10 is pretty low, 10 to like 40 is mild, and then it kind of goes up from there. So If you are worried about that, then that is something that you can talk to your primary care physician, that they can go and check that out for you and run that test and see kind of what's going on from a more diagnostic level. But let's kind of dive into exactly the biochemistry of what's going on with the cholesterol mechanism and what is causing that from a more functional standpoint, so we can understand how to inhibit it and how to use it to our own advantage when it comes to looking at functional problems. So check out this little video. So on this video, what you'll see here is that cholesterol actually is a proponent of all of your sex hormones. And so cholesterol gets converted into pregnenolone. Pregnenolone goes into your estrogens, your testosterone, your progesterone, your aldosterone, which is a blood pressure regulation hormone. And a lot of the times we have to work and think about this backwards. And when you're looking at this from a more functional standpoint, we have to say that cholesterol is elevating because there is potentially a hormonal issue going on, or there's more damage in the body going on, because remember we talked about it forming like the cell walls in the body, and vitamin D and those sorts of things. So when we look at this from a hormonal standpoint, we're saying that in this chart, a lot of the times your sex hormones are becoming deficient. Now, when we look at this pregnenolone steal, or what I like to refer to as called cortisol steal, if you're extremely stressed out, then what's going to happen is, or even if you have like an infection or you have chronic inflammation, what do they give you when you go to the doctor? A cortisone shot. So it either gets converted, your progesterone either gets converted into cortisol or cortisone. And with that, that just looks like the fight or flight response if there's a tiger. But today in society, the tiger is your job, your spouse, your family, your relationships, whatever it may be. There are so many things that are stressing people out now. And what happens is you're going to bias this cortisol pathway because it's a survival mechanism. And if you feel like you're just constantly running around all the time, like you're just trying to survive, then this is the pathway that you are specifically driving when it comes to that. Now, the issue with this is that it steals away from your sex hormones. So it's going to steal away from your testosterone and estrogen, but it's also going to steal away from aldosterone, which is blood pressure regulation. And when it comes to that, what we really need to say is that higher cholesterol production is our body telling us that we are extremely stressed out, and we're trying to create the supply for the demand that's placed on the body. So we're trying to supply the cortisol survival pathway, but we're also trying to supply the hormonal pathway over testosterone and estrogens. Now, I don't know about you, but I know a multitude of people that are on some type of hormone replacement therapy, or trying to boost their hormones, or suffer from hormonal issues, even thyroid issues, because cortisol will inhibit TSH and T3. So looking at this, you can say, maybe we need to do some more stress reduction activities. Maybe we need to increase our good fatty acids that we're eating in food, because obviously fats don't contribute to the issue with heart disease or anything like that. In fact, it can actually help reduce it. If you look at ketogenic diets or anything like that, there's actually more benefit in doing those. So, and also maybe we need to use some adrenal adaptogens in order to support that adrenal system, which is producing the cortisol. Maybe we need to do a little bit of meditation, journaling, stress relief. Maybe we need to dial back our exercise because it's too intense. Maybe we need to control our diet a little bit more from the inflammation standpoint. Because remember, fats, carbs, and protein are all good. It's just the types. Like if you're eating high sugary carbs, they're probably bad. If you're eating fats that are highly processed, that have been exposed to high heat, that are a little bit more oxidized, then obviously it's going to cause a little bit more of an issue. So with that being said, you can see just from this simple functional chart of how we can actually say cholesterol is telling us something that we're really stressed out. And now what do we need to help support that pathway, our stress pathway, but also our hormonal pathway as well. So hopefully this makes sense. Comment below if you have any questions about that, or you want me to do a deeper dive into that, and I definitely can do that. All right, Now, there are 3 natural ingredients that you can use to help support cholesterol if you don't want to take a statin, or if you want to kind of look at it from a more functional standpoint and do something like from a supplemental standpoint. You can use bergamot, garlic extract, and niacin. Those will all help support that cholesterol pathway and help kind of reduce it'll help support the adrenal system and the hormonal system, but it'll also help support the conversion of your cholesterol and help the processing in the liver. So with all that being said, I hope that you all have enjoyed this video. I know it's been a lot of information, but hopefully it's changed your perspective on why cholesterol could be high, things that you need to do in order to correct it from a natural standpoint, and then not just run to like a medication when you're having issues or something like that when it comes to these types of cholesterol issues. So if you haven't already, please like and subscribe this video. It really means a lot to me, and my mission is to produce you, to give you like the best content that I can and answer any questions and just what I see from a clinical standpoint of how I can help you the best. And I think that the whole medical paradigm needs to shift over towards this, and people need to be educated. So there'll probably, if you can subscribe, there'll probably be a link around here somewhere to one of my other videos if you want to check those out. There are many other topics, but there are also free resources and some paid resources down below if you want to check those out. And I hope you all have a great day, and thank you for watching. Bye.